Hi, I'm Brooklyn chiropractor Dr. Mark Poray, and I want to talk to you today about subluxations. The term subluxation was coined by chiropractors in the late 1800s and has been in regular use since then. Unfortunately, in the last few years, both medicine and dentistry have taken on the term subluxation to mean something in their own particular field, and that creates a great deal of confusion. So I don't use that term, even though a lot of chiropractors still do. I prefer the term segmental biomechanical spinal joint dysfunction, or a non-allopathic lesion. After trauma or wear and tear, nerves become triggered, resulting in muscle contraction, inflammation, and swelling. And that swelling then triggers more muscle contraction, and it becomes a cyclical issue which needs to be broken into. The chiropractor's job is then not to treat the organ or the muscle which is supplied by the nerve, but rather by the joint which is causing the problem to the nerve. In our office, the chiropractor will use hands and fingers to find a restriction in a segment, and what we'll look for is resistance. And we'll look at the left side versus the right side, vertebra above versus vertebra below, to see how they're moving. And we can find that segment. The patient will also know that there's an issue there because they'll feel tenderness around that spot. And then, using either manual or mechanical methods, the joint can be gently moved quickly, releasing nitrogen gas from the joint, stretching the muscles, and that starts the healing process. The whole process actually requires several treatments, just like any therapy, in order to reset those joint mechanics. The Ontario Chiropractic Association usually recommends about 12 treatments for an average uncomplicated problem. If there's a complicated problem or one that's been around for a long time, a chronic problem, it may be up to 24 visits. In my office, I like to see some sort of positive reaction within 6 visits. So if you're experiencing a treatment regime where nothing is happening after 24 treatments, you need to talk to your chiropractor about changing the approach or changing the therapist. I hope that answered any questions you might have about subluxations. I'm Dr. Mark Poray. I encourage you to check my website at www.drporay.com or give our office a call at 905-655-5767. Thank you.